And we're live. Dr. Kris,
Hi, Steve.
welcome back to your podcast. What are you doing, brother?
Oh, getting ready for the 4th. It kind of looks like in your blurred background, you're getting ready. It looks like you got a flag on the wall. So, hey, or something like that. I like it. So,
exactly.
Just getting ready for the 4th. Going to take a couple days off and enjoy the lake.
Well, I bet everybody's doing that. And there's a lot of folks out partying, going to get ready, going to see a bunch of folks. But today we're going to be talking about an issue that's on some people's minds, and it really bothers them. So I'm going to hit the intro with that little story hook, and we'll pick up after the intro. Here we go. If you're like most folks Dr. Kris Fusterhausen works with, you're active, you want to take ownership of your health, and you want to age gracefully. The problem is there is so much conflicting information out there about health and wellness, it's tough to know who to trust. Most providers are limited by what insurance will approve, so it can seem like they're only able to help you manage your health decline with more meds. On the Dr. Kris Life Podcast, you'll learn how you can regain your confidence in your health journey. You'll learn helpful knowledge about programs, supplements, peptides, and hormones that Dr. Kris has used with thousands of patients just like you to help them crush their goals and be their best selves. So if you're ready to take charge of your health and are wanting to stay active and healthy so you can be a better parent, partner, or lover, then you're in the right place. Welcome to the Dr. Kris Podcast. All right, welcome back, lovers. You got all these lovers listening in on you, Dr. Kris.
Evidently, right?
So today we're talking about, and this term, female pattern baldness, I never really had that as a term in my vocabulary or my head. I always had male pattern baldness down, but obviously it's a thing.
Yeah, it's actually very, very common. And so actually 40% of females at some point in their life will experience some form of female pattern baldness, and that number really skyrockets after menopause. And so we actually know that the lack of estrogen, with menopause, if they're not having it properly replaced, can absolutely increase the incidence. And so about 2/3 of females that are menopausal age will have some form of female pattern baldness. So the big difference between male pattern baldness and female pattern baldness is that women don't usually lose big areas of hair like men do, like receding hairline, which is what I did have before my neografting procedure, or on top on the crown, like a lot of men have, or all in between, like Steve, our moderator, is showing you right now. It's more of a global thinning is what most women experience. Okay, they experience a global thinning of their scalp, where basically they start losing hair and you start actually seeing scalp. Okay. It's typically first seen by their hairdresser. They're like, hey, Mary, I'm noticing your hair's not as thick as it used to be. And it can be progressive. The social stigma by that is like, guys lose their hair and they just look, as we always joke, you look more distinguished, and most guys like you just embrace it and like, heck, I can pay less for haircuts now. Mm-hmm. But it really does have a big emotional impact on females, because they're going to be possibly either just having to walk around with very little hair on top of their head or starting to wear wigs and things like that. And because a lot of ladies just don't understand what can or can't be done for their hair loss.
Wow. I was just thinking while you were talking that, we see a guy with his hair thinning and we don't think he's healthy. He's just losing his hair. But if you see a woman with her hair thinning, it might cross your mind is, I wonder if there's something wrong.
Yeah. Like what's wrong with her? Does she have cancer or something like that? And so, yeah, the biggest points I want to get across to start with is that, female pattern baldness is more of a global thinning. Okay. It's not just, obviously most women don't lose hair like men, but that it's very, very common. Again, about 40% of adult females will experience some form of female pattern baldness. And it comes from both sides of the family. That's another thing you hear a lot, but no, it comes from both sides. And so I always tell my providers, ask them, did your mom or grandmother on either side have issues like this? And most of the time they'll say like, yeah, mom had this problem or my grandmother had this problem. And then you can just start educating them on what can be done about it.
So, someone that comes to you and is concerned about it, I imagine there's like, do you do testing or do you just observe, or where does it begin?
So you can kind of really go multiple different ways with this issue. And what do I mean by that? What I mean by that is like the severity. So if I just have a lady that has a little bit of hair thinning, she's already one of my patients. We've already been doing testing on her. We may not do any additional testing. We may just give her some tips and techniques, because obviously the quicker we intervene with hair loss, the better results that we get. And no, unfortunately, we don't have a cure for female pattern baldness. Like I don't want to sit here and say like, oh yeah, we can 100% fix it. But most of the time we can dramatically slow it down, keep the lady with enough hair that she feels comfortable. But what you would typically want to do is you'd want to look at some basic hormone lab markers like thyroid, like menopausal markers, possibly like dihydrotestosterone, which is kind of a breakdown of testosterone, that sometimes some ladies have too much DHT in their system. So sometimes it's a matter of giving things to block DHT, or maybe it's things to actually give the patient hormones back. But especially thyroid, that's a big one that can speed this process up. So, and then you can actually do like, there's a genetic testing that we like to do on our patients where we collect some saliva, and then that test can be sent off to a lab where they genetically test which of the different topicals you might be more positively susceptible to. And we can talk about some of the common stuff that we use with these patients. But instead of just giving a patient prescription now for very little money, we can actually genetically test these patients and know what their body's going to handle better. So, some of the typical ways we can go about this is, let's say a patient comes in, we check their labs. If we certainly find something on the labs to treat, we want to treat it. That's typically not going to be the only treatment though, because the patient's already having hair loss or they haven't asked for this workup, right? So if I say, oh, it's your thyroid, let's fix your thyroid. Well, that's going to help, but we need to also do some other things to speed the process up. Again, we're talking about females specifically, and they're not going to be happy with, losing their hair. So if we get the genetic testing done, that can help guide us. But many times we like to use like minoxidil. Minoxidil is something we've all heard. It's, you can get it over the counter, but then you can compound it to stronger strengths. And it's very good with helping get better hair growth and thicker hair. We like to use it topically. It's actually a blood pressure medicine decades ago that was found to have this positive effect with hair growth. We also like to try maybe the alpha blockers like finasteride or dutasteride. And that's where all this genetic testing comes in. We can either just write these prescriptions, but now we can use some science along with them to actually test these patients to see what's best. Now, the problem with these minoxidils, dutesterides, finasterides, we don't, by the way, for providers out there, remember finasteride is a alpha blocker that can cause some birth defects. We don't like using it orally in females who have pregnancy age. That's why I like the topical. You don't have to worry about that with topical. But just remember that if they're childbearing age, you got to be careful with oral. It's actually not FDA indicated, although it's used frequently because of the birth defect potential with oral usage. But with your minoxidils, finasterides, dutesterides, if you stop them, all success that you have had will go away. All right. So any growth that you had will rebound and leave if you stop them. So patients are always like, well, how long am I to take this stuff? Well, technically the rest of your life. So sometimes that's a discussion you always need to have with your patients, because they may be like, well, I'm not signing up for anything I'm going to take for the rest of my life. Although I will tell you, when it comes to hair, they usually will sign up for it because it's not expensive. And if it works, it works. Because they're like, well, what worst case scenario is it works and I have to keep doing it? Yeah. Okay. I'll try that. But then sometimes we can go into the peptides, because the nice thing about peptides, we don't have to stay on those peptides for the rest of our lives. So, and many times we'll do combinations of these things. The most common peptides that we use is one's called PTD-DBM with methylphenolate. And that one's really better for true hair loss. So like either bald spots or like global hair loss and severe female pattern baldness. Now, by the way, you always have to have some hair growth to bring hair back. Okay. You know, if you have alopecia universalis, which means there's not one hair follicle, this isn't going to work. Okay. And that may be the guy that just, you know, there is some experimental stuff with JAK inhibitors, which really isn't for this topic, that are showing some hair growth in alopecia universalis. Going back to our days, Kojaks, you know, no hair growth whatsoever, maybe. But for the most part, we do have to have some hair growth. But PDD-DBM is with methylphenolate is a topical that actually is over the counter. We sell it on our shelves. We'll do good. And then we also like the GHK-Cu, which you and I've talked about before, as the copper peptide that is combined with zinc thymolin. That one's going to be more for increasing the density and the quality of the hair. So maybe somebody that's just really got thinning only, it actually can get rid of a little bit of graying of the hair too, which is kind of cool. So, you know, depending on which regimen I choose for those patients is nothing but physical exam, you know, like, hey, you know, if you truly are having thinning and loss issues, then we're going to use the PDD-DBM with methylphenolate with GHK-Cu and zinc thymolin. If it's one or the other, we may use them alone. But the advantage of those peptides is that we can use them for an extended period of time, but then possibly come off of them. Maybe not forever, but I could say, hey, Mary Beth, you're doing really good. You know, let's use them for 60 days on, 30 days off. And so at least they're not having to use them all the time. Although typically, anytime these patients do respond, they don't want to come off of them at all because they see the results. So that's kind of what we can do with peptides.
Are the peptides topical, oral, or injectable?
Topical. There is a great, which right now we don't have access to it because of that great category 2 finding that our FDA did. But, you know, thymosin beta 4, which you and I have talked about extensively with repair, it actually helps grow hair on the top of your head. And that's an injectable. Unfortunately, we don't have access to TB4 at the moment. We're hoping that down the road it'll come back. But yeah, these are just topicals. They use them once a day, no matter which one. If it's finasteride, minoxidil, dutasteride, you can actually combine those, by the way, in a compound. So you can have all of that together if you wanted. And then your the peptides that we talked about, the PDD-DBM, the GHK-Cu, those are topicals as well. Like I said, luckily those are over the counter. Like patients don't even have to see me. They can come in and we can just figure out what their concern is. They can grab them and go, or off our website if they wanted to do that as well. So those are really nice as well. And then, you know, if we want to talk about it, we start getting into, you know, some of the different procedures and modalities that we can do for hair loss.
So before we go to those, you mentioned hormones. Now, you know, we've talked about hormones and the benefits in many ways of checking those, but are you saying that hormones can also support hair growth? Or
yeah, it just depends on the you know, so estradiol or estrogen, when you lose estrogen, that actually has a negative effect on your hair. That's why we start to see after menopause hair loss, female pattern hair loss speeding up. Testosterone replacement can, you know, doesn't cause the hair loss, but if you're genetically predisposed to that and you get too much of it going over to DHT, which is, you know, possible, then that can actually somewhat speed up their hair loss. It's going to happen. We're just kind of speeding it up. So sometimes that's where a lot of times if we'll just keep a close eye on those patients, we can intervene with some peptides or something like that to keep that from happening. And then, like I said, if somebody's thyroid is off, they can absolutely have a negative impact on their hair quality, their skin quality, the actual thickness and growth can all be effective in a negative way by hypothyroidism or a low thyroid. So those are important things to look at. Supplements. We didn't even talk about that. Gosh, my staff would kick me in the butt for not mentioning that. A lot of times we just don't have the right vitamins in our system. So, like vitamin D and the B complexes and zinc, those are all crucial for proper hair growth. And so like in our office, we have a very inexpensive hair supplement, they call it the hair gummy, that a lot of ladies, typically when a lady comes in and even mentions hair issues, but they're not obviously like advanced, one of our first things we do is put them on an inexpensive vitamin. And, the vast majority of those patients come back. By the way, let's put something out there. Anything you do for your hair takes 60 to 90 days minimum to work. Okay. There is nothing I could recommend to a patient that you're going to see positive effects within 30 days. So you just have to know that going in. You got to try everything for at least 3 months. Okay. So you put them on hair gummies and reassess them in 90 days. It's amazing how many of those patients are really, really happy with their hair growth. And that's an inexpensive thing to do. Out there, one of the most popular programs out there, and by the way, I'm not saying it's bad, is Nutrafol. They've done a very good job of putting out a hair vitamin. It's on commercials. It works well. I'm not here to bash them, but I think their vitamin is somewhere in the $65 to $85 a month range, depending on how many you buy at once. I think ours is under $30, and it's, in my opinion, and I'm going to state that in Dr. Kris's opinion, they're very comparable. And so you can get a patient for under $30 a month, can get all the proper supplements and vitamins that they need to properly support hair growth. So hormones, vitamins, crucial to look at that stuff. And then you just start layering these things in. It just, again, depends on budgets, and it depends on goals, and it depends on how severe of a case we're dealing with. And one thing I just would, again, encourage females is to jump on this early. Don't let it get severe before you decide to do anything, because it's hard to treat everything the further down the path you get.
All right. So we've got supplements, we've got topicals, peptides, hormones, but there are some other things, even the treatment that you've taken on.
Yeah.
Let's discuss those.
So you can start with, like, probably the most traditional, mildly invasive way is called PRP. And PRP stands for plasma-rich platelets. It's where you draw your blood, you spin it in a special centrifuge, and then you re-inject it into small amounts into the scalp of the patient. Easy procedure, actually not very painful, although it sounds like it is. It's not bad. I've had it done. Not bad. The problem with PRP, again, is the same thing as it is with minoxidil, finasteride, and dutasteride. Works, but when you stop working, typically you do it on a 30-day basis for at least 3 treatments. So, 0 days, 30 days, 60 days, and then every 6 months afterwards. And if you quit doing it, you lose your progress. So you're going to have to keep doing it probably about every 6 to 12 months on a long-term basis. But that's okay. It's very safe, and it's tried and true, and it does help. We're more into stem cells or exosomes. We like those because that's actually taking, and it comes from the umbilical cord, from a baby, but you can take that and re-inject it into the scalp. A little bit more expensive, but can actually get more longevity out of it. So less times you have to do it, longer. You probably still will have to do it, but you're probably going to be able to get more like 12 real months out of that. Versus PRP, I find in our case, typically every 6 months, you're having to repeat PRP. After, they're all the same, 3 treatments in the beginning, 0 days, 30 days, 60 days. But then after that, PRP, I find you got to keep doing it every 6 months. I find with the exosomes or stem cells, every 12 months typically is perfectly fine. One of the best ways to treat this is low-level laser therapy, or LLLT. And that's an FDA-approved laser that we have in our office that is so safe of a laser that Steve can be on his phone or read a book or take a nap while he does it. Some lasers, you got to wear special goggles and this sort of thing. You don't have to do this. It's a 20-minute laser procedure. Basically, it's a machine. It sits right on top of your head, and you can sit there and do these treatments 2 or 3 times a week. And then we graduate them down as they do better. And again, remembering that most of our patients are doing combinations of these things. Okay. Like that's where we can uniquely come up with a program that is specific for each patient. Maybe they're doing the vitamins, maybe they're doing peptides, and maybe they're doing LLLT, low level laser therapy. Maybe they're decided to do the stem cells and low level laser therapy. Supplements really for everybody. That's just too inexpensive not to do. So pretty much everybody gets the supplements. And so, it's actually something that has FDA approval, which some patients feel good about. It will not bring hair back that is not there. Again, if a person has no hair follicles, LLLT is not going to work. And then typically we try to graduate them off at some point to laser cap therapy, which is basically a laser cap that is not as good as the machine, but is pretty good. And they can do that at home. So a few nights a week, they can just put their silly little cap on. I do. It's goofy as all get out looking. So you definitely don't want to wear it out in public, but you can turn it on and just sit there and watch TV for 30 minutes. And, that's what I'm graduated to. I just use my laser cap. And then because I've had this is another misperception is ladies don't understand that they can actually have FUE, follicular unit extractions, just like men can. And we use, of course, neograft, as we've talked about before in our practice, which is where we take hair follicles from the back of the head and we move them to other parts of the body. Again, most females are going to lose most of their hair, or thinning is going to be on top. Many times their sides and back are fairly well intact. So as long as we have enough hair follicles of the density that we need, we can pull those hair follicles and move them. And it's a very effective procedure. It does take 9 months to see that, it's kind of like birthing a baby. We do the procedure. We have to wait 9 months to see the growth, but it works very well. The fastest growing patient population in FUE, follicular unit extraction, is females. Believe it or not, they're not only doing their heads, they're actually now doing eyebrows, because so many women have plucked, waxed, tweezed their eyebrows because that's what was in. Now what's back in is thicker, more lush eyebrows, but they've plucked, waxed, or tweezed it away. So they're pulling, hair to actually put into the eyebrows to help that grow. A lot of times you can do this when ladies have facelifts. When you do facelifts, it can change your hairline. Believe it or not, because you pull everything and tighten it. Now you can actually move some of these hairs and actually keep a normal hairline, or to even sometimes hide a little bit of the scarring, the minimal scarring that they can get from facelifts. So a lot of women just don't understand that hair transplant, if we want to use that term, is actually just as much for women as it is men, and that the fastest growing population getting these procedures now is women.
Wow. So if I'm a female, the first thing I'm not, but the question that comes.
Well, you can be if you want to, right?
I know.
We shouldn't go there though, should we? We'll leave that alone.
No. So do I need to shave my hair to have my follicles moved around?
Yeah. So the great thing about female, the answer is yes, but let me explain that. Yes. So guys, when they come in, we say, go get a high and tight. Guys are okay with that. Go ahead and just shave it all around with a one blade, come in. If they're getting FUE, they don't have a whole lot of hair on tack. So it's kind of a normal haircut for a guy. Females aren't going to sign up for that. Okay. They're not going to go down and get a high and tight. So actually what we do is we always recommend let us do the cut, and our technician will actually layer it to where he'll like take hair and move it forward and then cut a strip, shave a strip, but yet they can still hide it with their hair length. And so ladies actually, typically you can't tell except for the first maybe week that they've even had this procedure done, because once the follicles take and all the scabbing is gone, they're fine. But for those females that are maybe concerned about that, we allow them to wear a loose fitting ball cap for the first 7 to 10 days. So as long as it's loose fitting, and we would walk them through it obviously, but as long we're in Texas, so ladies are okay with wearing ball caps. Like, hey, wear a ball cap for 7 to 10 days. And then after that, nobody's going to be able to tell you did anything. After the redness, the scabbing heals up, you're good to go, and as you remember my story, as long as you don't do anything silly and wear too tight of a hat band, because, my eyes swole shut and I had swollen eyes for 10 days looking silly. I promise it's never happened to anybody else. That's a silly doctor mistake. But yeah, so we do the shaving. Yes, we do have to shave the hair, but we can hide it to the best of our ability because we're not actually pulling the hair out. We're pulling the follicle out. So we have to get to the follicle.
So that when you say scabbing, that's it's not these big giant scabs. It's just little
No.
bitty.
No, so these are millimeter big follicles that we are putting into the hair, but we do, not to gross anybody out, we have to core those out so they create a little wound, which is going to have a little scab, and then we create a little wound to put the follicle in. That's going to create a little scab. But we're talking about small stuff here, and for a few days we don't let the patients touch that because if you could imagine, it's like until that follicle takes, it's going to be susceptible to coming back out. So if you go and shampoo your hair, you're going to wipe out 90% of the follicles. So we do have to let it, it's about a 7-day process of just letting it, take. They take faster than you think. And they do very well. And again, I know I'm not a female, just like you said, but they can use me as an example of, what I look like a year and a half ago versus what I look like now with my hair. It's why for what season is this, Steve? Season 5?
Season 5. Yeah.
Yeah. We had to redo all the pictures, right? Because
right.
I had no hair in all the pictures. So, and I will tell you, and I think females more than males, but not that I had low self-esteem. I'm not saying that at all, but it does help with self-esteem with hair. Sorry, Steve. But females, it's a really big psychological barrier for them. It really is. And again, guys look distinguished. Guys can shave their hair off and who cares really? I mean, honestly, and some guys don't give a damn. And I say, if you don't give a damn, I don't give a damn, that's fine. I get it. But ladies, I don't think I've ever met a girl that doesn't care about their hair. The psychological aspect of it is very much underestimated by us guys, I think.
Totally. So someone's listening to this and how would she's going to contact you. You're going to come in for an assessment. Is that what you call it?
Yeah, I just say call and start a conversation with us. Let us guide you on what your goals are. Like I said, this could be somebody as simple as like, no, it's not really balding. I just my hair quality is not as good as it used to be. It's thinning a little more than I like. They might not even have to see me or get blood. The over-the-counter stuff may work perfect for them if they're early on with this. But if not, then yeah, we're going to bring you in. We're going to do some blood work. Most likely, we're going to look at some things. We're going to make some offers to you, some different packages on what you could do. We're going to try to, come up with a unique package that's specifically for that person because it's not a one treatment fits all type of a setting. So we're just going to try to educate. I'm going to, of course, make suggestions on what I think is best and the most useful way to spend their money because we want happy customers so that we can come up with a program that will fit their budget and work for them.
So if they were to go to you, and by the way, we're going to talk about your new shop or your new store, or your online store, but let's say they want to go try some of the supplements on there. How long do they need to expect things to go before they go, all right, I need to go to the next phase?
90 days. So everything with the hair is a minimum of 90 days. And so if you're like, I'm just going to do a vitamin and see what happens, 90 days. If you're going to use the peptides, 90 days. If you're going to use supplements with peptides, 90 days. The only thing that's not 90 days is going to be the actual laser, 90 days. Okay. Neografting. Neografting is 9 months. So, but patients that have gotten to that point, I've educated them that, we're going to put hair follicles in, and in 9 months is when we're going to see the growth. Those are really cool though, by the way. Like most people don't need the grafting, but grafting is probably the most fun procedure we do because seeing these patients' faces 9 months later and they're, and realizing, what I would say about neografting is most people don't need it. But if you do, it's not as cost ineffective as you think it is. Okay. I think some people think I got to go to Turkey to get it done because that's the only way I'll be able to afford it. And you don't need to go to Turkey to get FUE. And B, they think that they're not a candidate for it. And so, I would say more people than not, we tell them they don't need it, but not that they're not a candidate for it. As long as you have some good hair growth on the side and back, you're most likely a decent candidate for it. So, and it's probably not as crazy expensive as you think it is.
So, all right. So you now have a store, by the way. Congratulations.
Thank you.
And so it's store.theresearchclinic.com. Now I'm going to try, I haven't done this.
Or they can just go to the website, right, and link it
Yeah.
right there too.
Yeah, exactly. And so I'm going to share the screen here. Let's see if I can do this while we're on a live stream. Let's see. Can you see that?
I can.
All right. So this is the store, and you can come in and see the products that.
Real quick, Steve.
Yeah.
Gut tides. So one thing that a lot of people who have bad hair also have bad guts. Believe it or not, we have a microbiome of our scalp, just like we have a microbiome of our gut. And so sometimes we'll put patients on gut tides for their hair because we know that poor gut health also leads to poor hair health. And so that just made me think about that when I saw that.
Now, is this NutriPack? What did you mention this?
No, but NutriPack is, so that's not our hair supplement.
Mm-hmm.
NutriPack is all of our B complexes along with ADK and DIM. But I'm sure if we look on the products, we'll probably see the hair gummies. I think they're up there. If you
probably in the for her.
Maybe. All right, let's scroll. Keep on going.
This is looking.
Maybe page 2.
Yeah, this is looking really good, by the way.
Okay, so like here's the hair care stuff. So that's the nice part. So like if you click on hair care rescue, and you scroll down a little bit. So this is the GHKCU with zinc thymulin product. This is the one I was talking about that's good for like thinning and quality of hair. And so, it's very good for that. If you go backwards, if you go click back, you'll see the other one. I think it's right below it. And that's the Activate. And Activate is the one that is the PDD DBM with methylphenolate. And this is for more like true hair loss. And so, but most of the time people want to combine these two. Now that I am going to say they may not have the hair gummies on here yet because if I remember right, because we're having a very hard time keeping it in stock. And it may be actually not the lady's fault. It may be the fact that we decided not to put it on here yet because of the difficulty in keeping it in stock, which that is supposed to be, I've been told, rectified very soon. So that wouldn't be surprising if it might not be on here, but the 2 hair peptides are.
All right. Well, good. That's exciting now that you have the store available.
Yeah, it's going to make it a lot easier for my staff. And, we get those immediately. We within 24 hours, we fulfill them, get them back out to everybody and keep everybody stocked up.
All right. And that's at store.theresearchclinic.com, or you can just go to the researchclinic.com and go to the store. And that's the same place where you would go to schedule a conversation with Dr. Kris on any of the various topics that we discuss on his show. Any last words of wisdom, Dr. Kris?
No, just, what, if your hair's bothering you, just come by and talk to us. We'll make the visit painless and we'll walk you through it. And if nothing else, we can better explain what we can do for you and maybe we can help. If not, we can just educate at least and we'll just go from there.
All right. And I tell you that, I didn't really expect it, but over a little bit, just less than a year, I could see a big difference in your hair from when we started working together and now.
Yeah. No, it's been tremendous. And so, I tell everybody, hair really wasn't my thing. People really get hung up on not having hair. I was just like, whatever. But I can tell you, and I actually kind of did the procedure reluctantly from our old podcast. It was like, NeoGraft was like, hey, if you're going to do it, you need to do the procedure. I'm like, I don't care. And they're like, no, you need to do it. And so I just said, screw it, I'll do it. And I'm really happy I did. I'm really happy with the results. I've had a touch up earlier this year, which now that's kicking in. And I think I'll probably for the rest of my life have a decent head of hair, which I'm happy about.
Yeah. And so you'll see in probably the series 8, Right now we're in the season 5. So when we get to season 8, he'll be looking even more like, I think your long-term plan is a Fabio look, right? To your shoulders.
I need to try to, oh my God, I would look so ridiculous like that. It'd be hilarious.
Okay, so let's do that. Thanks for joining the Dr. Kris Podcast. If you learned something today and you want to connect and get more information, visit our website, www.drkris.life, where you can find more great information or even schedule a time to learn how you can engage with Dr. Kris. Be sure to follow, like, share, and we'll see you on the next episode of the Dr. Kris Podcast. Dr. Kris is a speaker. If you need him for a conference on a particular topic, you can reach out as well. Sometimes he's able to accommodate you there. Anything else? So happy July 4th.
Yeah, just everybody have a happy, safe 4th.
Yeah. Stay out of this. Don't get too much sun, but have enough fun.
Remember, one cocktail, one water. Stay hydrated. It's hot out there.
All right. You heard it from the doctor. Doctor's orders. We'll see you. All right. Turning this.